Washington.
Well, for more on the situation in the United States, we can speak to Dr. Adam Brown, who joins us now from Envision Healthcare, that provides care to patients in hospital across the U.S. It's great to have you on the program, Dr. Brown. Can I start by asking you, please, just to paint a picture for us of what the situation is right now across the U.S.?
Well, it's a pretty grim picture. We're seeing a record number of cases across the United States, more so on the East Coast in some of our large population centers, like out in California and in Chicago. And from a hospital standpoint, we're also seeing a record number of hospitalizations, not only with adults, but also with pediatric patients. And that's on top of what we were seeing, of course, in the normal state of affairs during January, just after the holiday. Our hospitals. This is a pretty grim, frustrating situation for our healthcare workers and, of course, for our patients as well.
Yes, indeed, Dr. Brown, but my understanding is, and please do correct me if I'm wrong, that the number of people infected who've tested positive and are coming into hospital, we're only finding out about that once they're in. Isn't that right? What does that indicate about the severity of the disease at this point in time?
Well, I think what you may be alluding to here is that we are starting to differentiate between patients who are being admitted to the hospital with COVID and those who may be admitted for other reasons that have COVID. But the fact remains is there's a significant amount of resources that are required for patients who not only have it as a primary diagnosis, but also a secondary diagnosis. And from what I am seeing on the ground and from the conversations that I'm having with my colleagues, my clinical leaders from across the country, they are being really stretched and the resources are being stretched, causing significant issues with the healthcare system. So irrespective of the way that the disease is categorized, that may be important for us from a scientific perspective in the long run of understanding how Omicron or other variants of COVID may respond to the body in the vaccinated and unvaccinated. But the reality now on the ground is that we're seeing a significant number of cases and it's causing a lot of strain.
How close are we to hospitals being overrun, and how concerned are you about that?
Well, I'm very concerned about that. Remember that cases come first. Hospitalizations typically come a week to 2 weeks later, and then sadly deaths can come after that. And so if we're seeing record number of cases and then record number of hospitalizations now, over the upcoming weeks, we're going to see even more hospitalizations and greater strain. So I've had some people ask me about healthcare system collapse, and it's not like a light bulb that gets turned off. It's more symptoms of delayed care, ambulances that may not be at your home when you need it, or even services in hospital that are not available when you need them. Those things are starting to happen now. We've even seen in Florida, a mother and baby ward have to close down because multiple staff members are getting sick. So those are some complicated issues that we're seeing here in the United States as we try to deal with Omicron.